Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance and the CB Health Insurance YouTube channel. Welcome to our channel. If you're new to our channel, please be sure to subscribe, hit the little bell so you get notifications of future videos that we release. And don't forget to tell your family and friends, give us a thumbs up and like our videos. Now, today's topic, what doesn't Medicare cover, or what do they exclude? And I get asked this a lot, usually when somebody is going to have one of these services done or needs something like, hey, is this covered by Medicare? And the perfect place to see what Medicare does and doesn't cover is the Medicare and You Guide. The Medicare and You Guide is published by CMS, Centers for Medicare and Medicaid. Every year they come out with a new one. They typically snail mail it to you. You can download the PDF from medicare.gov, or if you contact our office, we will provide it to you if you're our client. It's about 125 pages, and just so you know, it's a PDF, so when you open it, there's a little magnifying glass. You can actually type in "not covered," the words, and it will take you to the page and the list of items that are not covered. So it's about page 50 of 125, something like that. But I'm going to go over that list so you don't have to reference that. So what is the first thing? Most dental care is not going to be covered by Medicare. Remember, Medicare is the health insurance plan. It's not the dental plan or the hearing or vision plan. It's the health insurance plan. So most dental services are not going to be covered. I actually did a video on how you can get dental coverage. You can watch that because it has some really helpful and useful information in it. But that's not going to be covered by Medicare. What else is not covered? Most eye exams that are going to be for prescription lenses. Okay, that's different than if they're looking for a glaucoma or something like this. But if you're getting a prescription filled, that's not going to be covered. And again, I did a video on how to get vision coverage if you're a senior on Medicare. So check that out. But that's not going to be covered. Your prescription glasses and your exam to get the prescription glasses is not going to be covered by Medicare. Dentures, that's another teeth area, that's not going to be covered. Cosmetic surgery, right? We all know this for our group health plans. They don't cover a little nip tuck. If you wanted to take care of something, get rid of that extra chin. That is not what health insurance is designed to do. It's supposed to cover diseases and conditions if we get sick. So unfortunately, Medicare is not covering that. So no surprise to most people. They're not covering, and this is interesting because this is the exact verbiage in the Medicare and You Guide. It says we don't cover routine physical exams. What? Most people get an annual exam. Interestingly enough, it does cover an annual exam, but an annual exam can be designed to look for problems. Routine is typically, there's nothing wrong with you, they're just checking you out. So they word it very strangely, and if I gave 2 cents to the government, I'd say, can you word this better so people aren't so confused? They do not cover a routine physical exam, but they do cover an annual exam. So that's good news. Hearing aids. A lot of seniors need assistance hearing. A lot of seniors need assistance and don't go get an aid. And I know a few of them myself, and I'm hoping that's not going to be me when I start losing my hearing someday, but they can be very expensive. And there are some Medicare Advantage plans out there that do cover hearing aids and hearing the exam to get fitted, and you can check that out. But Medicare, it alone, if you're on traditional Medicare, is not going to cover hearing at all. Last but not least, long-term care insurance. And long-term care, a lot of people think of nursing home, which is true, but it can be skilled care. Medicare is going to pay up to 100 days of skilled care, but there are some prerequisites. So you're supposed to be hospitalized for 3 days before going to the skilled nursing home, and you have to be getting better. It has to be skilled care. If you are continually at the same level and you need help with what we call activities of daily living, the ADLs, this is what kicks on a long-term care. You need help dressing, toileting, getting out of bed, transferring, taking your medications, those types of things is what skilled care does. If you've had knee surgery and you get sent to a nursing home temporarily or skilled care facility to get better in rehab, that's one thing. But again, Medicare is only going to pay 100 days. After that, for a long-term situation, they're not going to cover it. And this is why a lot of people buy long-term care insurance. The other thing, which is not listed in the guide, is one of the things not covered, but it falls under the same category, in my opinion, as long-term care, and that is home health care. Home health care is not at a skilled nursing facility. Obviously, it's in your home, but it's the same type of care. It's that skilled care where somebody is helping you with activities of daily living, dressing, bathing, eating, those types of things. If you're coming home from a rehab and you live alone, for example, a lot of times they don't want to send you. They're going to have somebody come in to help you out as long as you continue to get better. So if you look under the Medicare guide, you will see that they cover home health care if it is by a skilled nursing facility. So it's not just an aide, it's somebody with a degree after their name, and it must be medically necessary and approved. In all the years I've been selling, which is over 30, I have yet to see Medicare pay for home health care. So that's another reason, and it's not listed in the not covered section because they say, oh yeah, we cover it, but I haven't ever seen it covered. So that is something that people should seriously consider if they're turning 65 or even before then, is looking at some sort of long-term care coverage that covers both a skilled nursing inpatient as well as a home health care situation. So those are some of the items that are not covered. Hopefully there are no surprises there. You can check the guide. And if you like this video, give us a thumbs up. We'd love to hear your comments. And don't forget to share it with family and friends or people you know that might benefit from this. Until next time, thank you for watching. Kathy Bukowski, CB Health Insurance.